So I think what the president did a much better job of doing is introducing the public plan as competition to keep the private for-profit insurance industry honest. And I think that's what it was intended to be from the beginning, not a huge governmental takeover of healthcare. But I will tell you on that issue, if you look at a comparison, objective comparisons, the Kaiser Family Foundation, those groups that seek to find the truth between, you know, what is being debated back and forth, you will find that, you know, the majority of people who are on Medicare will rate that system very good or excellent. The vast majority of people that receive benefits through the Veterans Administration, probably 27 million people in this nation, rate that care very good to excellent when compared with for-private insurance industries. The other thing that's, I think, is morally wrong and fundamentally unfair is that if you're an individual and you pay your health premiums and you're diagnosed with a life-threatening illness, which is very expensive to treat, insurance companies, private for-profit insurance companies, incentivize their employees to find a technicality to cancel your policy, despite the fact that you've paid these premiums throughout your life. They do the same for small businesses. Let's say you're an employer and you have 100 employees and one of them gets a life-threatening or is diagnosed with a life-threatening illness. What the insurance company can do is jack up the premiums for that small business, making that policy unaffordable. Whereas they have two options. One is to drop it and then go seek another carrier with the weight of somebody with a pre-existing condition, which will result in very, very high insurance premiums, or the employer is forced to pull back, which results in the employee having greater out-of-pocket expenses for co-pays and that kind of thing. Look, it's a very American value to have, values to have choice and competition. And don't be afraid that a public option or a not-for-profit option will, crowd out the entire for-profit industry. Look, if you're going to be insuring another 47 million people, they should be finding ways to more effectively compete for a good portion of that business, because a lot of these people are very desirable. Why? Because they're young. The month of August was acrimonious activity. I wouldn't even call it debate because it really wasn't debate. It was fake debate. It was, you didn't have a counterpoint based on factual information. You had people trying to present factual information and then other people mischaracterizing. You had fact distortion going on, deeply misleading, and there was an intended purpose, and that was to confuse people, and it worked. I don't think that the proponents of health insurance reform anticipated that. But the good thing is, over time, it allowed for an honest, objective evaluation of what was fact and what was fiction. And I think the death panels that are still being promoted by highly irresponsible elected officials and former elected officials, which is shameful because it's just not true. But they don't have a strong, factually based counter-argument, so they resort to distortions, which are intended to confuse, not enlighten. I mean, if you really have a compelling counter-argument, then make it, because logic will win out in the end if it's a rational debate. But if it's not a rational debate and your intent is to confuse, then that's what the result is. So I think that month of August, that 6-week period, was okay. It was cathartic in a way, because I think what the president did, he called out the opponents of change. And he also called out the deeply misleading information that they were advancing. But he also welcomed them in and said that if you have constructive ideas, advance them, and they should be considered. I think a step in the right direction was tort reform. The president acknowledged that that should be part of this debate. As I said, it's a huge industry with a lot of moving parts and a lot of very, very well-financed special interests on both sides. And I think what the president did on Wednesday night was, carve out a middle ground. And that's, I think, where the American people are. If I have something to say about this, it's going to be factually based. It's harder for that information to get through when people come in with a preconceived position, and that is to oppose and to disrupt. I didn't want to subject people to that. So I met with patients throughout the month of August, throughout the month of July, and I'm doing it in the month of September. I'll do it through the month of October, November, as long as this debate lasts, seeking people out, just not stakeholders, although I met with doctors and nurses. So I think that time was more constructive as opposed to this big, clash of the titans forum whereby, this one's going to scream louder than that one, and people are going to leave confused. I thought it's better to have the one-on-one discussions. It's better to communicate as directly as you can with constituents. So I think it was the right decision to have made. And I think a lot of that stuff was just silly. And if it was orchestrated, it was planned, it was financed by opponents of change. And it worked for those that fell into it. Now, let me tell you this. If there weren't all these debates about getting all the angst out, would we be better off? Maybe. Because I think we had a steeper climb after all the confusion was out there. And real beneficiaries of healthcare reform didn't realize that until I think a lot of them heard the president the other night. Being able to, but for one member of Congress, being able to outline a clear plan in general terms, some specificity, and also a welcoming of new ideas that could be embraced. But when you just simply say that we're going to eliminate fraud and abuse and that will take care of everything, that's not true. I will continue to emphasize the importance of a strong public option, defined in the way that I think a public option works best for all Americans, for those who are without insurance and for those who have insurance. How much are we going to compromise to get one Republican vote to say that it's bipartisan? As you stated, this election was a mandate about a number of issues, including this one. So ideally, you want a bipartisan bill appealing to the practicality of moderate Republicans. But if you can't go, let's move. And I think that's what the president did. He said, okay, I don't think it was strategic. I think it was established probably in panic. But I think in retrospect, this strategy will have worked because all that angst got out there. And let's be honest about it. There were underlying anxieties about race, about the economy, and about, ideological politics that came to the fore during a lot of these town hall meetings that really had nothing to do with the issue of health care. And the people that were so vociferous in their opposition to health care were, in many cases, people that had a Medicare card in their back pocket, were, in many cases, people who just adopted, what was being said through media outlets, electronic and print, with no basis in fact. I think in the end, my vote on H.R. 3200 and my advocacy for a strong public plan is the best that I can do. It's the best that I can do to ensure that there is a strong public plan in the final product.